Radiographic positioning, VTNE, and final exam review. Understanding the different body planes is going to be a very important thing as you prepare for the VTNE. We have the definitions right here, and on the next slide we do have the body planes coming from your A&P textbook, your Colville, page 4. This textbook is one of the best resources for your foundation. One thing to note though is cranial and caudal. Cranial formerly was anterior, caudal was formerly posterior. So please keep in mind that we may still have some members of the veterinary team that use this language, and it's not wrong, it's just what they've been getting away from over time. VD versus DV. So the first kitten here is in ventral dorsal positioning, meaning the x-rays are going to travel from belly to back. And so as we think of the calipers, we are going to need to measure this way. So measuring the thickness, think of where the x-rays are traveling through our patient. This is one of the more difficult things when we are doing our measurements. So we're going to want to measure what's going through, think about the direction of the x-ray beam, and measure the thickness of that patient. Dorsal ventral. This is going to be where the x-ray beams are traveling from back to belly. So the animal is laying on its ventral aspect and the x-rays go through dorsal to ventral. We still have to be extremely careful as we are positioning the animal because we need them to be nice and straight. And if we're getting like a pelvic radiograph, then we need to make sure that the head is straight, traveling all the way down to the limbs. If anything is off center, then we are going to have some challenges when it comes to keeping the animal straight where the veterinarian needs to see it. Right lateral versus left lateral. X-rays are going to travel depending on how the animal is laying. So if the animal is laying on its right lateral, then it's going to be traveling, then its right side is down and the x-ray travels from the left side to the right side. And so as we measure the patient, we're going to need to give them a hug with the calipers on each side to be able to look at that true measurement. And remember, when we use the calipers, we are measuring in centimeters, not inches. Here we have an animal on its left side, left lateral. The left side is against the table. So the x-rays are traveling from the right side to the left side. Remember that right lateral is the typical standard view as we are taking our radiographs. We always need to have two views because remember our animals are in 3 dimensions. So 2 views will give us a true look at what's inside that animal. And the principle of the pineapple and the banana is a really good way to think about this, that if we are shining a light from one direction, we're only going to be able to see that one thing. And so like if we shine a light laterally, we can only see the pineapple. If we shine a light ventrally, we're only going to be able to see the banana. And so being that we need 2 views, kind of like this lion here, looking at it from one direction, it looks really, really bad. And from the other direction, it's like, oh, she's just doing her job. Positioning aids are always a good thing to use. We have foam pads, sandbags, ropes, ties, suction cups, cords, gauze, and troughs to be able to help us take a good image. There is like a little scruffer for a cat that can be used as well. The positioner is a really fancy trough where we can hook in the limbs. And there is a really, really good video that I will link in the notes here for you guys on positioning without using your hands. So hands-free positioning when possible for the safety of the operators. Now, of course, the safety of the patient is #1 for us. So if you can't use sedation, if you have to use your body to help restrain, manual restraint, then think about some of the ways that we can distance ourselves from the beam. Positioning for the thorax, we're going to measure the thickest point of the chest. And so we have those arrows right there to help us with that. Lateral to lateral will be side to side for a right lateral x-ray. And dorsal to ventral, the spine of the spine to the sternum, is going to be what we use for a VD positioning, using those calipers and measuring, of course, in the centimeters. Even if you have a fancy digital machine, you still should be measuring using the calipers and put that into the machine to take as good of an image as possible. Then that way the veterinarian can adjust from there to be able to enhance their image as they need. If we are doing positioning of the thorax, then soft tissue, heart and lungs, we're going to do right lateral, right side down, the legs extended, left lateral, left side down, the legs extended, and then ventral dorsal will be ideal with the legs extended going forward. In some cases, dorsal ventral is the only option if our patient is very painful or critical, and in those cases, we do the best we can. One of the big keys for us, though, is when we take our radiograph, we're going to take the radiograph at full inspiration for the thorax. So as the animal breathes in and the chest expands, we want to hit that at peak inspiration when we take the radiograph. For abdominal radiographs, we're going to be looking at a lateral view and a ventral dorsal or dorsal ventral if we must. We want to measure at the thickest point of the abdomen, and we take abdominal radiographs on expiration. So as the animal breathes out, we're going to have them, and then, yeah, so at expiration, so as the animal breathes out, that's when we take the radiograph. So patterning their breathing and paying attention to when the breathing happens is going to be very useful for us. We're going to, as they breathe in, we're going to start our radiograph halfway down, get the rotors moving, get it primed, and then as soon as they breathe out at peak expiration, that's when we are going to take our radiograph. Extremities are typically going to be a tabletop view, especially if they are less than 10 centimeters. 2 views can be done on one film if we are using film radiographs. If we are using digital, we will have the capability even to put them up next to each other as the veterinarian views them. We want to make sure that we are using our markers to indicate the extremity. Extremities can look extremely similar, and so that can be a real challenge if we aren't using our appropriate marker. And remember too, if we are doing like pelvic radiographs, we want to make sure the dependent limb is on the bottom. So dependent limb, bottom, that always has to go forward. So dependent limb will be the bottom limb, and that should always be moved cranial. The top limb should always be moved caudal. Make sure that you use things like gauze. We can use towel clamps, things like that, to be able to take our radiographs without getting our hands in or near the primary beam.